Hi, this is Stephen-Castro, and we are going to talk about systemic lupus erythematosus. Lupus is a chronic systemic autoimmune disorder. It's known as the great imitator because it's easily confused with some other disorders. It often has flare-ups followed by remissions, and it creates a lot of physical and psychosocial challenges for clients. So since it's systemic, it can really affect almost any part of the body, but some are more common than others, such as the skin, the joints, definitely the kidneys, occasionally with some heart issues, blood vessels, as well as the lungs. Here are some general statistics about lupus from lupus.org. It does have about 1.5 million Americans that are affected over the three types. It's primarily women and more common in non-Caucasian women. There are a few different types of lupus. Systemic lupus erythematosus is going to be the one that we focus on for this class, but there's also discoid lupus, which primarily affects the skin, as well as subacute cutaneous lupus. Some other less common forms of lupus are drug-induced lupus, typically from medications that are listed here, as well as neonatal lupus. Again, not very common. For systemic lupus erythematosus, we do want to emphasize that it is an autoimmune disorder. It's very complex and not really well understood. There may be a genetic component, and as well as some women also may be affected due to the Epstein-Barr virus. Here are some more common symptoms of lupus, including but not limited to fever, the butterfly rash, chest pain upon breathing, which is the pleurisy, the sensitivity to the sun, unusual hair loss. It would be wise to make a list of these common symptoms. Here is a photo of that marlar or butterfly rash that is one of the textbook signs of SLE. SLE affects the musculoskeletal system by causing a lot of arthralgias and myalgias. Again, if you're not familiar with some of these terms, you'll probably see them on the exam, so I encourage you to define all the terms that I've listed in the SLE and RA prep. All the terms can be found in your book. In addition to that butterfly rash, they also have extreme photosensitivity. A lot of your teaching is going to center around keeping the client's skin protected from the sun, as well as alopecia or thinning hair. Clients with lupus are always going to be at risk for renal failure due to the nephritis. So you always need to do a very thorough renal assessment on your clients. Also, you may have some cardiovascular effects due to the constant inflammation, such as pericarditis. Pulmonary manifestations of lupus may include pleural effusions and pneumonia. They also get inflammation of the lining of the lung and may have some pleurisy or pain in the chest with deep breathing because of that inflammation. GI manifestations may include some abdominal pain. Hematologic manifestations may include anemia, leukopenia, thrombocytopenia. Neurologic function can also be affected. It may be mild to severe, anywhere from just headaches to seizures to peripheral neuropathy up to psychosis. Lupus is very difficult to diagnose. Frequently, physicians have to rule out other disease processes before they can narrow in on a diagnosis of lupus. There are 11 main criteria for lupus, and clients have to have 4 of those 11 criteria symptoms to be diagnosed with lupus. A lot of labs for lupus may include those that are based on the immune system, such as the RE factor, the ANA, and ESR and CRP. They show a picture of the immunity as well as signs and symptoms of inflammation. There are all kinds of diagnostic tests that can be run for lupus, but we typically look for systemic involvement. For For instance, if we're worried about kidney involvement, you're definitely going to watch that BUN creatinine and watch for signs of elevation. Also, since this is an inflammatory process, we want to watch those labs that show increase in inflammation. There is no cure for lupus, so our goal is to minimize the complications, control the symptoms, and watch for flare-ups. One of the primary signs of flare-up starts with a fever. We need to suppress that overactive immune system and decrease inflammation, and this typically revolves around medications. NSAIDs may be prescribed to help with inflammation, pain, stiffness, and fever. Antimalarial drugs such as Plaquenil may also be prescribed to help with those systemic effects of SLE. If this is prescribed, it's very important to watch for renal function and any type of vision impairments. Additional medications may include the glucocorticosteroids to help with that inflammatory process, as well as immunosuppressants such as methotrexate. I want to make sure that you research methotrexate and are familiar with it prior to the exam. It's pretty frequently given, and there are a lot of side effects and contraindications. Benlysta is one of the newer immunosuppressants that have been out on the market. It came out around 2011. It probably won't be on your exam, but I do want you to be familiar with it because I do see it clinically prescribed pretty frequently, and you may see it on the NCLEX exam or elsewhere. There are a lot of opportunities for education with clients with SLE, including avoiding the sun, make sure they have protectant or cover themselves as far as sun exposure, stay alert to flares or exacerbations such as a fever, maintain their active lifestyle, get lots of rest, and good nutrition. Other teaching may include smoking cessation, watching alcohol intake, looking for a potential support group because this is a lifelong chronic disorder, monitoring clients who are on birth control because it may add to flare-ups, as well as mild soaps or shampoos because of the alopecia. I have posted a guided reading for lupus and for rheumatoid arthritis in Blackboard. I encourage you to fill that out. If you have any questions, please don't hesitate to reach out to me. Thank you and good luck.